Hi, I'm Nicholas Taylor. I've been helping mental health patients for 14 years, and I'm going to show you today how we can quickly and effectively increase patient safety as well as staff safety. Today, we're going to define a problem with safety in the mental health day rooms. We're facing a lot of trouble, and patients are getting hurt, staff are getting hurt because the TVs are not secured in the day room properly. I'm going to show you today how we can quickly solve that problem and how we can save money in the future. The big problem with the TVs that are mounted, they are too free and too accessible for patients. Patients are using screws and the bolts to hurt themselves, cut themselves, to stab other patients and staff, to hit or strike other staff with the TVs, and it's just becoming an increasing problem. When trying to correct the situation, we try to obtain control of the patient without the patient getting hurt, without staff getting hurt, and that's not always the situation. Unfortunately, patients suffer lacerations to the head. Staff have to take days off because they're hurt or injured, have to go to the emergency room, and it's just not a nice scene. It's not a pleasurable workplace. In just 2019 alone, you can see here in the chart here that a large portion of the chart shows that those incidents involving TVs. The other incidents include patient chairs, utensils, and pencils. With the TVs not being properly seated and protected, anybody is at risk when they come into the unit. Who is at risk? Doctors, nurses, uh, the patient visitors, cleaning staff, anybody who's in the hospital. It poses a great risk to them to be there if screws and bolts are missing or if a TV is snatched down from the wall. It doesn't help anyone. Jackson's mission and vision have always included patient safety. Safety has always been number one, not only for the patient, but for everyone around. And implementing the solution for this problem is going to take care of this quickly and efficiently. All we have to do is be proactive. There's a very simple installation process for fiberglass that can be placed around the TVs so they're not accessible by patients. There's a locking mechanism on the side that anyone can use who has clearance, can use a key to go into the case and remove the TV or adjust the TV as needed. Also, remote controls are going to be very good because they can still get access to the TV to change channels and use the TV as needed with the fiberglass covering the case. Also, the state requirements are minimum in regards to the TVs, so we're going to exceed those expectations. As we said before earlier in the video, safety is our number one concern at Jackson. And we just want to keep reiterating that, and we want to be proactive. We want to step in front of most situations as much as we can. Thank you very much for your time. I am absolutely sure that with implementing this process of fiberglass installation, we can minimize and help Jackson be number one again. Thank you.